is someone a candidate for an implant? Well, yeah, if you have one tooth missing, you're a candidate. If you have multiple teeth, or if you don't have any teeth, or if you have dentures that just don't stay in good, I mean, you are a candidate for implants. And we can go into that a little bit. Yeah, you're the technology guru, because we use technology in implants is, I mean, the state of the art.
Yeah, in fact, it shouldn't be done any other way, because when you're starting to deal with dental implants, these are essentially a surgery, and you want to make sure that it's as safe and as accurate as possible. So something that we've really strove for is to make sure that happens is we've integrated the technology into the implant process. So let me just kind of walk you through what we do to kind of show you the process. What you'll come in, like he said, first we'll get a CT scan, which shows us in 3 dimensions what your bone, where your nerves are, all of that, and sinus cavities. You have all of that we want to make sure that we avoid and is protected and placed right.
And with that, we can actually take an implant and put it right into that CT scan. So we can put it in the place, the angle, exactly where we want it to see if we have room.
So we go and we plan it all virtually. I analyze the CT scan. This is just recently in virtual reality. I'm actually able to look at it in real time and see where your nerves are, and to be sure that we're avoiding, even adjacent teeth can come into factor. So once we plan it all out, and we're able to take that information, all this done virtually, and we make what's called a surgical guide. This surgical guide allows us the day of surgery to place that implant exactly where we planned it virtually, with no error, which avoids and super safe, and actually makes it faster. The guide's 3D printed now. Right here in our office, we show you what that looks like. It's fun.
And that's a big difference, because usually in the past we've had to send out to a lab to have this guide made, which takes a week or 2. Most people are doing that. Very few offices have a 3D printer where they can actually make their own guide. So
if someone really wanted the dream scenario, they could come in, get all that CT scan, I could plan this surgery, make the surgical guide, and we can place an implant within an hour later.
And actually have the crown made to fit where that implant goes. Yeah. I mean,
all done from start to finish in one office, not having to go to other places. It keeps the continuity of care.
Yeah, and that's one question I would ask if you're going to get an implant. Ask if they do it guided. A lot will say, well, no, I've done so many of them. It just doesn't matter. Experience is good. When I first started, I placed everything without a guide because we just didn't really do guides. But now with the guide, why would you put it in free-handed? You might get it just right, but you might not, and usually it's not. So why not get it right every single time? So that's one thing I would ask is, do you place your implants guided? Because we're getting close to nerves, we're getting close to the sinus, and it's important to be extremely accurate.
You've heard of the phrase, measure twice, cut once.
Yeah.
That's a great philosophy to stand by when you're looking at replacing a tooth. And in the end, what's great about it, the benefits are you can have a tooth that's stronger and better than ever before. You'll be able to eat again. If it's a denture that hasn't fit well, it can be anchored to that so it's not moving around. You'll be able to floss in between if it's an individual tooth. It's overall just been a great procedure.
Really, implants have been just one of the great additions to dentistry, and that's probably why I'm still practicing, why I'm not retired by now, because that's really been exciting.